All right, welcome everyone. My name is Erin Wilson. I'm one of the officers for the Decalogue Society of Lawyers. I wanted to welcome you to our annual Family Law Hot Topics, and we have two amazing speakers today. It's a little bit of a different format than we've done in years past, but I know both of these therapists well, and I thought just hearing from them, from Dr. Anast and Dr. Wilner, would be fill an hour and a half and be extremely helpful for our practice. So with that, I'm going to introduce both of them, and we're going to talk about how parental personality disorders impact parenting and parenting. So first we have Dr. Beth Wilner. Dr. Wilner is a licensed clinical psychologist and a mediator who has been in private practice since 1993. She's the founder of Families in Transition, which is a comprehensive psychology practice offering a wide range of clinical, consultative, and conflict resolution services. Individual, couple, family, and group therapies are offered, addressing a broad range of issues and concerns, including mood and anxiety disorders, ADHD, marital and relationship distress, high conflict divorce, substance abuse and behavioral addictions, health behavior change, and domestic violence. FIT also offers a full spectrum of conflict resolution services, including divorce co-parent consultation and education, divorce and post-decree mediation, parenting coordination, collaborative divorce coaching, and child specialist services. A specialized women's divorce group is also offered on an episodic basis, focusing on the challenges of divorcing and co-parenting with an abusive or high conflict co-parents. Dr. Wilner received her PhD in clinical psychology from the Illinois Institute of Technology with highest honors. She's been trained and certified in mediation by the Center for Conflict Resolution and received an additional advanced training in family and divorce mediation through DePaul University's Center for Dispute Resolution. She's completed her collaborative divorce in Illinois interdisciplinary collaborative family law training program, is a fellow of CDI, and volunteers as a faculty trainer for CDI's annual 2-day basic training in collaborative divorce. She's also volunteered as training faculty for the AAML 40-hour mediation training course, speaking on topics including cognitive bias, mental health, substance abuse issues, and use of reframing and other mediation management communication strategies. Dr. Wilner is a member of the Association of Family and Conciliation Courts and is currently serving on the board for the Illinois chapter. Next, we have Dr. Cara Anast. Take note if you've ever worked with her. The way to pronounce her name is Cara Anast. Got you, Cara.
This is true. This is true. Thank you for that.
You're welcome.
That's all you need in my bio right there.
Dr. Anast is a licensed clinical psychologist. She graduated with her bachelor's degree in clinical psychology from Carthage College and went on to receive her master's and doctorate from the Illinois School of Professional Psychology. Dr. Anast has worked in a variety of settings, servicing a wide range of individuals with varying levels of psychopathology. She began her career working as the lead crisis specialist at a psychiatric hospital. She then moved to working in a therapeutic day school for individuals on the autism spectrum before moving to Counseling Connections, the private practice where she is currently working. She began her private practice career by providing therapeutic support to individuals with a wide variety of psychopathology, including autism spectrum disorders, anxiety, depression, personality disorders, and mood disorders. She also completed neuropsychological testing for individuals with autism, ADHD, anxiety, depression, personalities, and mood disorders. While she continues to provide psychological testing, she decreased her therapy caseload to begin training to complete child custody evaluations and court-ordered psychological testing. She trained for a year before being added to the Lake County Evaluators list and was appointed for her first case in 2018. Since her first appointment, Dr. Anast has been appointed in over 100 cases in multiple counties. She's published an article on child custody evaluations with individuals on the autism spectrum and presented on this topic, as well as parental alienation, psychological testing, neurodivergence, interviewing children, personality disorders, and the differences between 215 and 604 evaluations at various conferences. She's a member of the Lake County Bar Association and the Association of Family and Conciliation Courts. So welcome to both of you. I will turn it over to you. And the one thing I will mention is that I will monitor the chat for questions. So feel free to throw questions in at any time, but I will ask the questions at the end. So thanks so much. And I'm going to turn it over to you now.
Awesome. Thank you, Erin. And thank you guys for having us. I think I speak for Dr. Wilner and myself. We're very excited to be here to talk on this topic. So we're going to talk about personality disorders. It's really a hot topic in our field. And I know just in the law community, it's one of those things that everyone wants to know more about. So hopefully we'll give you some more knowledge on that today. So first and foremost, when we talk about personality disorders, there is an overarching definition for all personality disorders, and that is that they are an enduring pattern of inner experience and behavior that deviates markedly from the expectation of the individual's culture, is pervasive and inflexible, is stable over time, and contributes to significant distress or impairment in interpersonal relationships. Now, the reason I put this here is because, when we talk about statistics, people often, I know you guys hear it all the time. She's a borderline. He's a narcissist. Those are those buzzwords we hear all the time. I'm here to tell you that not everybody is a narcissist and not everybody has borderline personality disorder. Now, statistically speaking, honestly, there's so many different statistics out there. We don't have one statistic at this point. The average, though, is about 1 in 10 people has a personality disorder. So, or I shouldn't say has it, meets criteria, which is different. A lot of times people may have a personality disorder and are not diagnosed, but they do meet that criteria. The other thing to keep in mind here, and these words are really important, and that is pervasive and inflexible and stable over time. A lot of people will say, well, in this situation, they meet criteria. If they are only meeting criteria for the past month, that is not a personality disorder. It has to have been present in multiple contexts, has to be present over a stable period of time. So a lot of times you'll probably hear mental health professionals when you speak with them about personality disorders say, when did it start? What did that look like? When did we see these things? Because we cannot diagnose this specific disorder without knowing the history and without knowing that it is stable over time and also consistent in multiple settings. Next one, Beth. So with personality disorders, every single one of these really does have dysfunction in 4 main areas. Now, there's a lot of different areas within these 4 topics, but these are the big ones to think about. And that is that there's some level of dysfunctional thinking that happens, whether that's they're black and white thinkers, with paranoia, there might be some of that we'll talk about. And that feeling is the emotional dysregulation that happens. That's consistent across personality disorders, that you're going to see their inability to regulate those emotions. Disruption in their interpersonal relationships. So sometimes it's an inability to even initiate. Other times it's that maintenance. They cannot maintain those interpersonal relationships for one reason or another. And then impulse control. Typically, you're going to see these very, very impulsive behaviors that really do cause some dysfunction throughout their life.
All right, so today we're going to talk about 5 core personality styles that tend to show up in our work in the court system, and certainly in the domestic relations division and in any family law setting. And that is borderline personality, narcissistic, histrionic, paranoid, and antisocial. One of the things that I'll say about these categories is just that these are categories that have been created as a way for clinicians originally to communicate about human behavior. And so when we say someone has a borderline personality disorder or borderline personality traits, it's simply a way to communicate this person presents with a predictable, understandable cluster of behaviors, whether those are cognitive or emotional or behavioral that are expressed between people. And it helps us understand sort of the trend and the tendency of these individuals. As we'll talk about in a little bit later, people don't necessarily fall so cleanly into one category or another. And so what we're talking about today are high conflict personalities. We select these 5 because these are the ones that show up most predictably when there's high conflict in a co-parenting dyad, when there's high conflict in a divorce, when people cannot reach agreements, when they end up in Kara's office doing a custody evaluation. These are the highest conflict individuals who cannot compromise, problem solve, or reach agreements without intervention. And one of the ways that I like to think about each of these personality styles is with an understanding of what is the core underpinning or the motivation for these individuals' behaviors. So when they become emotionally dysregulated, when they act out behaviorally, when they do things that seem outrageous or wildly inappropriate based on social norms, we can understand these individuals and their behavior by remembering the core fear that each personality is operating from. So, for example, people who have borderline personality traits or borderline personality disorder are operating from a place of a deep fear of abandonment. And so, if they're in any type of relationship, whether it's their romantic relationship with their child or with professionals, if they start to experience abandonment of any sort, this is going to be a trigger for their less functional behaviors and interpersonal style. People who have narcissistic traits or a narcissistic personality disorder are operating from a fear of inferiority. And so they tend to move through the world striving for superiority in every relationship that they encounter. So that can be in their marital relationship. They're constantly striving to be superior in the one-up position, and they need to somehow suppress, minimize, denigrate their partner so that they are constantly inferior to them. You will find that this happens also in your professional interactions with people who have narcissistic traits. They can feel very threatened. They don't want to be in the one down position, and this can often trigger some of their less functional behaviors. People who have histrionic traits or histrionic personality have a deep fear of being ignored. And so these are the individuals that tend to look dramatic, sort of over the top, attention seeking. They fear that they won't be heard, listened to, they'll be ignored. And so when they get activated, when this fear gets activated, they will present in these overly dramatic ways. Paranoid personality traits or personality disorder, these people are operating from a core fear of being exploited, taken advantage of, or harmed. And so they move through the world trying to protect themselves from that. And that's where a lot of the suspicious, what we would call paranoid behaviors tend to come from. And finally, antisocial traits or antisocial personality, these people have a deep fear of being dominated. And so these are individuals who move through the world trying to dominate anyone that they are in relationship with or who they're interacting with. And this can lead to very socially, culturally antagonistic and not normative behaviors. And these are the folks that we work with who don't follow court orders, they don't follow rules, they don't think rules, limits, boundaries, or even laws apply to them. The other thing that relates to talking about how these 5 categories are not so clean and discrete is that anytime we're talking about personality, everybody on this call has a personality, right? Or at least we hope you do, right? Your personality is a description of how you relate in the world, how you relate to other people, how you think, how you experience and express emotion, as Kara talked about, how you manage your impulses, all of that. And so personality traits can fall on a spectrum or a continuum of severity from mild to severe and everything in between. And so, the other thing to recognize is when we're working with people who are going through divorce or who are in conflict post-decree over child-related issues, we're experiencing them under a great deal of stress. And in many ways, we're encountering them at the worst time of their lives. And so stress is going to exacerbate some of the worst traits in any of us. And so if someone has personality traits, but they don't meet the criteria for a disorder, on the mild end, individuals who have any of these high conflict personality styles, they may present as controlling, manipulative, passive aggressive, overly sensitive or sort of prickly. But it doesn't go beyond that, right? So you can still work with them, you can still interact with them. That's more on the mild end. As these traits move on the continuum toward the more severe end, where they would more likely meet a full diagnostic criterion for a personality disorder, these are individuals who can actually become dangerous or harmful to the family, to the children, to the people in their lives. People will describe the dynamics in the relationship as toxic. They're often rageful, explosive, or even unsafe to live with. They may be perpetrating domestic violence of various forms. And living with a person who has a very high conflict personality and who leans more on the severe end of the spectrum of severity can cause legitimate trauma to the people around them, their partner, their children, people they work with. Even as a professional working with these individuals, the more severe they are on this continuum of severity, the more difficult it is to work with them, and it can really become challenging, unnerving, or even traumatic. And then, as I mentioned before, let's remember that people can have traits across several different types of personality styles that's not clearly fitting into one diagnostic category or another, and they may not reach a criteria for a disorder, but they still may have enough of these difficult traits that it makes it very difficult for them interpersonally to relate in healthy, appropriate, pro-social, functional ways.
So we're going to start with borderline personality disorder, and we're going to talk about two things. We're going to talk about some of the common behaviors that you're going to see with these individuals, and then we're going to talk about what you can do. How can you manage some of these behaviors, and what should your practice then look like? And we're going to do that throughout. I do also realize that, we probably should have said this at the start. We're not going to go through the criteria. I know you guys have probably all been a part of that presentation where everyone says, here's the criteria, but know that somebody can have traits. Somebody could have, for borderline personality disorder, you have to have, 5 of 9 traits. They might have 3 of those traits. So when, Beth is talking about has traits, they might meet 3 or 4 of the criteria, but they don't necessarily fall into that clinical category of having the full amount for that diagnosis. So borderline personality disorder. So when you're working with these individuals, it's going to feel like you are seeing 2 different people sometimes. And that sometimes can happen all in one session, where I want you guys to also keep in mind that core belief that Beth was talking about for this group is that fear of abandonment. So what that can look like is because of their way of thinking, which is kind of this all or nothing type thinking, they fall into this love-hate kind of relationship with people. So there's going to be times where they're going to think you are just the best thing since sliced bread. You're going to be everything. They're going to fall on your every word, and they are going to trust in everything that you say. In those moments, they're going to appear very endearing. They're going to be pretty vulnerable at times. And they're going to listen. They're going to focus on what you're saying. Then there's this other side when all of a sudden, and again, that fear of abandonment kicks in where I don't want to be abandoned. You might have said something that triggered that you may not even realize you said. And all of a sudden, now for one reason or another, and it can happen quite quickly, now they don't want to talk to you. Now they can be more volatile and they can turn to anger at times, and be a little more standoffish or volatile. So what that can look like is then you're getting those frantic calls or emails kind of constantly happening that are telling you some pretty heinous things. They might say some pretty terrible things in that moment. And again, most of the time it's pretty impulsive. They're not thinking these things through. They're not doing it in a malicious way, even though it's going to feel that way. It's more they're feeling out of control. You've triggered that fear of abandonment, and now they're trying to protect themselves by saying, nope, I don't like you. Most of the time, what's going to happen though is pretty quickly that can turn back and they're going to try to undo it. They're going to try to make up for that loss of control. They're going to try to come back to you and have that relationship again. I have a lot of people that have asked me when I've done these presentations, how long does that take? Everybody's different. Everybody's different. Like I said, it can happen fairly quickly within a session. Sometimes it lasts a little bit longer. It really does depend on the person's level of experience and trauma potentially, and kind of what they've experienced in the past. The other behavior that is really prevalent in what we do is that splitting of professionals. Borderline personality disorder individuals, people with borderline traits are masters at splitting. So they're going to take the professional that they like that day, and they're going to attempt to put you against the one that they don't like. Come on my side, right? I'm right. That person is terrible. Can you believe they said that? And so when we're looking at, and we can go to the next slide, then how you guys can handle some of these behaviors is, first and foremost, I want to point out that these individuals really are good at making you feel a loss of control. They're not meaning to, believe it or not, but you're going to feel confused, out of control. What just happened? I was the best thing since sliced bread at the beginning of this session, and now you hate me, and you're sending me all these emails. What happened? So keeping in mind that that's the feeling that a lot of professionals who work with these individuals will say, there it is. And that's kind of how they're going to make you feel. Again, keeping in mind, whenever that's happening, take a step back and remind yourself, it's a fear of abandonment. This is not a me thing. They are not angry at me. They are afraid right now. And the other thing to keep in mind here is that for them, they feel out of control. They feel inconsistent. One of the best things you can do when working with individuals who have borderline traits is to be consistent. Whether they're in the love part of their cycle or they're in the hate part of their cycle, you set boundaries and limits. You are consistent with what you say and how you do things. That will make it easier for you. You set that limit of saying, I'm going to respond to you within 28, 24, 48 hours, whatever works for you. Then when they're emailing you multiple times, you didn't respond to me, they're so angry at you. Your response is simple. It is setting limits, and you say, as previously discussed, I said I would respond within 24 hours, right? When they are back in that session, you remind them of the limits, you stay consistent. That way you, regardless of whether they're in that love or hate part of that cycle, you are still a consistent person in their life, and that's what they need. The other thing is how we were talking about that splitting. When you know you've got a borderline individual, it is very important to talk to all professionals on a regular basis. That is extremely important. Not only are they probably telling professionals things that are partially, if not all the way untrue, that's probably also happening with you for other professionals. And so you want to make sure that you're touching base. Hey, here's what's going on here, what's going on there. Make sure that everybody is consistent and on the same page. And then also make sure, DBT, so dialectical behavioral therapy, is really the evidence-based practice for treating individuals with borderline. One of the best things you can do for anyone who's got borderline traits is to ensure that they have individual therapy. And DBT is really kind of the top tier at this point for these individuals. So next we're going to go into narcissistic personality disorder. And we're going to talk about those behaviors. So I'm going to remind you again, that's that fear of inferiority. These are individuals who are They are very self-righteous. They want to be top of the game, their game. They are very self-centered. They can lack empathy. Okay. This line of personality disorders, when people say narcissistic, people get a feeling. People often get a very negative feeling. I will tell you that you probably know somebody who is narcissistic, and there are a lot of really good traits. I should say for all personality disorders, there are positives. There are some people who are narcissistic who are CEOs of Fortune 500 companies because they have some of these traits. So this is the one I always feel like I have to defend because people are really harsh towards this one. They often have a really bad feeling when I say narcissistic. They can make you feel a lot of different feelings when they're sitting in your office. They also kind of have these two sides to them to be aware of. Number one, keep in mind, they can be extremely charming individuals. They can be very slick and manipulative and very, very charming. Most people who eventually realize somebody is narcissistic will start by saying, "Oh my gosh, they were so kind. They were so nice. They were very charming and have really positive things to say," until that fear of inferiority comes in. And what that can look like then can be very volatile. That can look it kind of have that impulsivity and be unexpected and have more of that anger, and they will exploit other people for their own needs. So they're looking to meet their own needs. They're looking to do things in their favor. They also often think that they are right. And so what's going to happen is they're going to tell you that they're right. They're going to tell you that their way is the best way to do it, and that's how it needs to be done. So now what do you do? So next slide, we're going to talk about when you have this person, in your office, what is the best thing you can do? Again, I'm going to stress understanding where it's coming from, that fear of inferiority. So one of the biggest triggers for somebody with narcissism is that what they're going to do is they're going to, anytime you evaluate them, when they feel like they're being negatively evaluated, that's that trigger to get some of those behaviors that we don't want to see. So you're all like, yes, but we have to tell them what they're doing wrong. So how do we do that? There's a lot of different things. Number one is avoid that direct criticism. So making what any kind of recommendation that you have seem like, hey, this is to get you what you want, right? So we're not saying that what you're doing is wrong necessarily. It just may not be the best way to do something in this situation. And we're going to get you what you need if we try a different way. That can even sometimes, when it's not direct, that can still be a trigger sometimes. So keep that in mind. You could do it in the best way possible. You can use your sandwich technique. So, positive, negative, positive. And even then, sometimes they're still going to be volatile. So you want to make sure that you know that. More importantly, too, is again, that consistency. You are going to report to them the same way each and every time and set those limits and boundaries. That's going to be a common theme. I feel like both Beth and myself are just going to keep telling you to set limits and set limits and set limits, because that's really the biggest thing, and hold your boundaries with these individuals. One of the things too to keep in mind with individuals with narcissistic personality disorder is you do want to have a level of praise. However, you don't want it to be the only thing. You want to make sure there's a balance. So that praise and that criticism can come hand in hand, and find that balance. So that you're ensuring that while they're getting the criticism, you're also kind of feeding that self-centeredness and that grandiosity so that you can gain that rapport. So the praise is to gain rapport. The criticizing is to make sure you're getting the work done that needs to be done. So that balance it's a delicate balance to have with these individuals. One of the other really big things too is helping them to view situations through their child's perspective. So people will often ask me, well, isn't it true that narcissists don't love their children? Absolutely not. Absolutely not. That is just not true. They have a different way of operating in those relationships, but they are able to love. That's not a thing that is not, it is possible. It happens all the time. And so again, this individual that they love, that child that they love, if you can show that individual, hey, this is how they're seeing the situation. This is why this is negative for that person. They're going to be more willing to come around to your critique, because what you're saying is this is what's in your best interest or your child's best interest. So that's really the key there when you've got somebody with these traits.
Next up is antisocial personality, behaviors and traits. So these are the individuals who feel that normal rules, social norms, codes of conduct, or even laws don't apply to them. And so these are the individuals who will see not following court orders, breaching court orders, even breaking the law. And one of the challenges in working with them is similar to the narcissistic presentation, is they can seem very slick and very charming initially. They also are very skilled at lying and deceiving and manipulating, and they do it so convincingly. When their their core fear of being dominated gets triggered, you may start seeing more of the irritability or even aggression toward others start to emerge. So they go on the offense, right? Because they're trying to prevent themselves from being dominated. What we often see when you're working with parents and children is these are often the adults who they may fight for time with their kids. They may make a case for why they're a perfectly great parent, maybe even a better parent than their co-parent. They want this time, they want the responsibility, and then when they have it, they conduct themselves in a way that is very irresponsible in caring for their children. They may take risks that are well above the level of neglect or putting children in harm's way. And they may not even take care of their children's basic needs when push comes to shove. They tend to disregard other people's safety. So they will behave in risk-taking, aggressive ways. And they don't think through consequences the same way that the average person does, and they don't think about the impact their behavior may have on the people around them, and that includes their children, unfortunately. These are very often, I would say with very high probability, someone who truly has an antisocial personality, if they are in a relationship, a romantic relationship, a marriage, a partnership, and there are children, there's very likely going to be some history of domestic abuse or domestic violence. Largely due to the core fear and the way that they tend to act out, they go right toward hostility, aggression, or abuse as a way to push back against when they start to feel vulnerable. And they'll use tactics like threatening, taunting, scaring, or intimidating in order to stay in that dominant one-up position. So how do we work with these people? So as mentioned, these are individuals who are going to ignore court orders. They'll ignore professional recommendations. They don't show or demonstrate or even feel much fear. They don't demonstrate remorse. They're not concerned about consequences, repercussions. We may view them based on the irresponsible parenting as showing really poor judgment, putting the kids in harm's way with high risk or the irresponsible behavior. And as I mentioned, the acting out that can border on or cross into abusive. And so one of the things, whatever role you're in, whether you're sitting on the bench or you're a GAL or you're a PC, or even if you're just working with a high conflict set of co-parents in any capacity, any agreements that are reached, you have to put them in writing. these individuals, because they will break the law and ignore court orders, ignore rules, boundaries, you need everything to be documented and in writing so that there's at least a paper trail that you can lean into when they've breached an agreement, a court order, or broken the law. You want to be highly skeptical of their self-report, because remember, these are individuals who can lie and deceive very, very skillfully. So you can't take them at face value. You can't rely on their self-report. You always have to cross-check and cross-validate with other sources that can kind of check their story, check their narrative. If they are behaving inappropriately toward you, or if you're on a call with that individual and the co-parent, end the call. I think as professionals, we need to have a very low threshold of tolerating behavior that may start to rise to the level of abusive. I know that I've experienced this at times, that doing this work for so many decades, my threshold of tolerance for hostile, aggressive, threatening, abusive behavior on a call or a Zoom or even meeting in person is pretty high. It's sort of like, you know, being in the trenches for so long, I'm desensitized to a certain degree, but that doesn't mean the person that I'm working with, the co-parent, has that level of desensitization. And so we have to be really mindful of what the other people who might be participating in the conversation or in the session with that parent with the antisocial traits, how it's impacting them and where they need that boundary. And so I often find myself having separate shuttle or caucus meetings with individuals like this, because putting them together with their co-parent or even other professionals, it can escalate and rise to a level of completely ineffective very, very quickly. And lastly, one of the strategies that I've seen some attorneys do that I think is really, really wise is if you're counseling your client and the co-parent, you're concerned about the co-parent and safety issues with the child, one of the best things you can do is make sure that child is interacting with someone who's a mandated reporter. And so that might be a social worker, a psychologist at school. It might be an individual therapist who's working with that child, or a family therapist. Someone who is a mandated reporter is going to be in a position to report to DCFS if something gets reported by a child or something is observed or there's a concern. And these are folks that you know may require orders of protection or other legal boundaries to protect children or other people in the family. Histrionic traits or behaviors, again, these are the individuals who have a fear of being ignored. And so they present as dramatic, sometimes flamboyant, exaggerating, telling very, very colorful stories. And they have a very colorful, dramatic way of expressing themselves. But when you listen to their narratives or their stories, you may find that there's a lot of words and there's a lot of colorful language, but there's not a lot of detail or substance. And so it takes some effort and skill to get them focused and drill down into the content that's really necessary or important for whatever that situation is. They may present physically in ways that are also dramatic as a way to attract attention. And this might be shown in inappropriate or age inappropriate ways of dressing or grooming. They have intense emotions. They feel things very intensely and deeply. And as Kara pointed out with one of the other personality styles, their emotions can shift very rapidly. And so you may see a whole range of emotions with these people inside of one meeting. They tend to stir up drama, they seek drama, and they do things to try to keep themselves at the center of sort of the cyclone of attention. And it can often be very difficult to keep them focused on whatever the task is at hand, whether it's coming up with options and proposals or problem solving, coming up with an action plan. It's very hard for them to stay focused. And so what do we do to work with these people more effectively? I think in advance of meetings with them, having a clear written agenda is very important, because then it gives you something concrete and tangible to go back to and keep redirecting them back to, that these are our 3 agenda items. Let's make sure that what we're talking about is meeting the needs of these agenda items. And if there are other things you want to talk about, we can add it, but we're going to stick with these 3 for our meeting today. And then on the back end of it, if you want them to work on something in between meetings, homework, if you will, it's often important to also put that in writing. So again, it's clear, it's tangible, it keeps them focused, and it keeps them accountable, and it gives you something to continually refer back to. People with histrionic traits are storytellers, and they like to tell very lengthy, dramatic stories, but it often can be rooted in the past. And for the most part, what we're all doing in this arena is we're trying to orient people to the future. How are we going to change things going forward? And so you may find that you have to redirect with their narrative, curtail it, and again, redirect them to present and future. And one of the ways that you can shift that is by asking a closed-ended question that's pulling for yes or no, or for a fact, as opposed to a narrative, which is a more open-ended question. And lastly, drawing from Bill Eddy's work, which we have some of his work in the references at the end of this presentation, he has a protocol based on redirecting people when, and this works really well with individuals with histrionic traits, but anyone who's doing that lengthy narrative storytelling, or trying to express and prove their side, or why the other person is in the wrong, is to redirect by asking them, what is your proposal? What do you want to request? What solution do you want? By asking them to state their proposal, you're cutting off the long narrative, and you're helping them think about, okay, instead of complaining about all the things this other person has done, what do you want? Is a really, really effective strategy. Oops, wrong direction. And lastly, of the 5 styles that we're going to talk about today are paranoid personalities, or personality traits. And these are the individuals who are fearful of being taken advantage of, exploited, or harmed in some way. And so they will look and feel suspicious, very distrusting. It's hard for them to enter into relationships where they actually trust the other person, whether that's a romantic relationship or professionals that they need to work with. And so they'll feel and act in a very defensive manner. They may even have a hostile, sort of aggressive feel to them. They're sort of prickly and brittle. They're easily offended. So something that you say that you didn't think had any negative twist to it can really trigger them. They can be very easily offended. It's very difficult for them to hear or accept or internalize anything that feels like criticism. They hold grudges, so it's very, very hard to forgive or work through a forgiveness process. And it's very, very difficult to help them compromise with others. And a lot of this is based on the low level of trust that they're living with, and that fear that someone's going to take advantage of them. So if I compromise, if I give in, am I then going to be taken advantage of? Is someone going to pull one over on me? It's going to take a lot of time with these individuals to build rapport. to get them to trust you. And so they're not going to readily open up, tell their full story, express their concerns, or confide. It's going to take extra time. And they tend to read into other people's behaviors. So they see nefarious motives in other people. They assume it, they interpret it, they project these covert meanings or nefarious motivations into other people's behavior, typically normal behavior. And they're over interpreting and projecting. So how do we work with individuals who tend to be suspicious, distrusting, or paranoid? One of the things I often think about is if you're working with parents, like co-parents, and you suspect that someone trends towards some distrust, paranoia, suspicion, you want to make sure everything that you do is as transparent as possible. Because remember, they already are going to tend to assume that you're doing something to pull one over on them, or to exploit them, or to do them harm. And so this can show up as, you spent an extra 30 minutes with the other parent, and now they're reading into what that means and how unfair that is, and now you're on their side. And so you want to be cautious that your process is transparent, so nothing feels like a secret or it's being done behind their back. The process is balanced, as closely as you can. I know that's often difficult, but to really be mindful of having equal time. Whenever possible, have both parents be on emails, or when you're sharing feedback or sharing information, do it simultaneously so they hear the same thing at the same time. Because they're so sensitive and reactive to anything that feels like criticism, you're going to need to provide things as gentle coaching or suggestions, options, things to consider, as opposed to being more direct of, what you're doing isn't working and here's a strategy that might work better. They will recoil from that and they won't be able to take it in. And last, with the suspiciousness and the paranoia, there are going to be a lot of cognitive distortions. Assumptions they're making, reading into people's motives. And so once you've earned a little bit of their trust and you've developed rapport, you're going to want to gently challenge their belief, for example, about the other parent and their nefarious motives, or their belief about another professional working on the case and their nefarious motives, right? So it's sort of like, this is going to date me, but they used to call this like, do the Columbo approach. It's a really old TV show. Hopefully some of you are familiar with that, but it's sort of asking in a curious, wondering sort of way. I'm wondering if, I hear that you view their behavior as this, but I wonder if this other way of thinking about it might also explain their behavior. So you're kind of coming at it through the back door with them. Coming at things directly with them is just going to trigger that suspiciousness, and they're going to put up a boundary and recoil. Now I'll pass it back to Kara for some overarching global strategies that might work with any of these high conflict personalities.
Yeah, so as you heard us say, and I said we were going to sound like a broken record, but those firm boundaries and clear expectations are so important. When you know you've got individuals that have these traits, that's really the core of the work that you've got to do, is setting those boundaries, setting those expectations, making sure they are clear with everybody, and then control that room. When you have them all in there, or even just one, it is your session, it is your room, it is your meeting. And so you do want to jump in if the clients are interrupting each other, or if one is kind of dominating the conversation. Hang on a sec, I want to hear from the other person in the room. You're the one that has to stay in that control. And then redirect. I know that, Beth was saying, sometimes they can for different reasons, go on these kind of lengthy narratives. You want to bring it back to, okay, that's great. Let's focus on what we were talking about. We can talk about that at a different time, but remember, we set that expectation. Here's what we're discussing today. Really important to always go to that future orientation. They are going to try to take you back. They're going to take you back sometimes years and years and years because that's what it feels right to them. And so they're going to do that reorient. Okay, how are we going to fix this in the future? What are we going to do to make it better in the future? Mirroring emotion and behavior, that's a really key one with all of these different disorders. That's an important one too. And that praise and reinforcement. You want to praise and reinforce those constructive behaviors. And then, and the statements, but you also want to make sure that, that praise can come in a lot of different ways. Each one of these personality disorders for different reasons really does respond well to praise. They want to please for different reasons. So that is usually really well received. This is a really good thing. Doing that often is really helpful. Reframe their language. They're going to use different ways of saying things that is going to feel harsh, is going to feel kind of attacking at times. And that reframe is going to be really important in the work that you guys do. And then caucus, that's a really important thing. Each one of these, when we were going through each one, there's going to be something that's going to trigger them, right? We talked about the abandonment. We talked about that inferiority. If you know that there's a topic that's going to trigger that person for one reason or another, that may be something where you say, we're going to meet separate first so that we can get through the brunt of that kind of anger that might come out, or that impulsivity, or those words that are not very kind. We're going to do that one-on-one, and then we can kind of bring it all back together. I will tell you guys, one of the things to keep in mind is these individuals are going to make you feel a certain way, and it's usually not positive. You're going to leave some of those meetings with these individuals and kind of go, what just happened and why am I feeling a certain way? Go back to that very first thing that we were talking about with those core fears. If you can look at somebody and say that behavior, that whatever they were doing is the result of a fear of something, it's not going to make it feel better when they call you all sorts of names and are mean to you, but it is going to give you a reason that you can then say, okay, this isn't about me. This is about something else. And then, the biggest thing I will say is make sure that you guys are consult with a mental health professional, consult with one another, and just say, I'm struggling with this client. Can you help me kind of name it or put something on it where I can then have a better relationship or a better rapport with this person? Beth, I don't know if you wanted to add anything to that.
Yeah, I think, it's funny, even though Kara and I put this presentation together and put this list together, when I sit and listen to this spoken out loud, it's just like a checklist right down the line that I can think about, so many cases start coming to mind of ways in which I needed to use one or more of these strategies in order to just make the meeting even, moderately effective. One of the things that I hear from a lot of parents when I'm meeting, and it's often on Zoom, where I'm meeting with two high conflict co-parents trying to help them communicate, problem solve, make decisions, is that they feel very, they're very reactive when they feel the other person has interrupted them. And so I've learned through experience that I have to be on the lookout for that, because I will often have a client, especially if they're feeling very sensitive to that in the moment, they'll look to me and say, well, why aren't you stopping him or her? Why aren't you, I gave them a chance to talk. Why are you letting them interrupt me? And I may not have even seen it the same way that person saw it as far as interrupting, but it's really important to watch for that. And one of the ways that I've sort of gotten more skilled myself at doing that is I will say up front that I'm asking them to talk about X topic, and we're going to take turns. One person's going to speak and one person's going to listen. And that way, and then we're going to switch. And that way we're setting the stage for one person to be able to speak what they want to say all the way through to completion. The other person listens. I may even have them summarize what they heard and then flip it around and let the other person speak, listen, and summarize. With Zoom, one of the things I love about Zoom, and this, of course, we only learned from the pandemic forward, is I have found Zoom to be beneficial tool when working with the highest conflict co-parents, because when I used to have them in my office sitting across from each other, they were feeling each other's emotion and energy constantly. And there'd be people storming out of the room, slamming the door, screaming, not able to stay engaged, just getting dysregulated to the extreme and not being able to re-regulate. And then I would have to caucus by putting people physically in separate rooms and going back and forth. Having people on Zoom, don't be afraid to use the mute button, which I do all the time. And again, I tell people up front. So that's like this first bullet point, setting your boundaries and expectation from the very start. So I may say to couples, if I'm anticipating they're in a very high conflict place right now, I will say to them up front, please be aware and please bear with me. I may interrupt. I'm not doing it to be rude or disrespectful. I'm doing it to help your process. I may ask you to mute yourselves at certain points if I feel like the conversation is going sideways, or I actually may mute you. Please understand I'm doing it not out of disrespect. I'm doing it to try to help the process be effective and keep you engaged. I've also found that the highest conflict individuals can stay engaged longer on Zoom, I think because they aren't in each other's physical presence. So I have actually at times redirected clients, even if they wanted to meet in person. I've redirected to Zoom because I thought I could keep them in the conversation longer and we could get further along.
I was going to add too to that.
Please.
That's what you just said too about muting, is that if you're able to say to somebody, mute yourself, and they do, that's an excellent time for praise. I really appreciate you following through with what I just said. I'm sure that was really hard for you. And I really appreciate that you were able to do that to help the process, because you're taking that situation that you know was really difficult and telling them, hey, when you do these things that I know are hard, that's a really good thing. That would be an excellent time for praise there.
Yeah, that's a really good point. Anytime these higher conflict clients can sort of re-regulate themselves, that's a time to acknowledge it. And that's really what, when we say praise, it's even as simple as just an acknowledgement.
Exactly.
Right? Like, thank you for muting yourself. I really appreciate your support of our process right now. It can be very simple. Or, someone who takes a deep breath, stops for a minute. I might just jump in there and say, that's an awesome strategy. I saw what you were doing there. I encourage both of you to use that pause and that breath to pull yourself back to center so that we can do some constructive communication here. And if you praise someone in front of their co-parent, that's also a big ego stroke, because if they have any of these traits like narcissism or antisocial, they want to be superior. And so praising them in front of their co-parent, it's just a little moment of kind of feeding that without really injuring the other parent in any way.
And on the opposite side of that, I would say, keeping in mind that for somebody with a personality disorder in the situations that you guys are in, it's giving them an audience, and that's not comfortable for them. When you have to criticize, when you have to do the opposite of praise, that's when you got to say to yourself, okay, is this something that is going to work well with an audience? And I understand that what I'm saying is one person, but it's one person that they don't want to be wrong in front of, or they don't want to feel vulnerable in front of. And so that's another kind of delicate balance of, is this one of those times where it's okay to say this in front of that co-parent, or do I need to consider an alternative route? Because an audience for somebody with a personality disorder, you're asking for some more of those negative behaviors to happen.
That's really well observed. Yeah. And that's where I think caucusing in the moment can be helpful. I think it's either, making notes to yourself of the feedback you want to give them and do it separately in a one-on-one, or if it has to happen in the moment, use the beauty of Zoom and put one person in a waiting room. The person you need to give the difficult feedback to, do it privately. And you can even, I make a point of letting them know that I did this intentionally, because it also is a rapport building moment, and they can trust you that you're not going to say something that actually humiliates them in front of their co-parent. So I make a point of it's almost like an external dialogue explaining what I'm doing and why. In certain moments, that alone is a strategy, right? Like I needed to share this difficult feedback with you. I did not want to do it in front of your co-parent. I don't want to put you in that position. But I think this will really help you. And so I wanted to share this with you. It's easier for them to hear it because you've started with, I've structured something out of respect for you. And so already they're in a position of, oh, okay, well, thanks for doing that. You protected me with that boundary. Kara, anything else with this global slide?
No, I think that's that. We do have after this in your slides, there are two different kind of reference slides, things to kind of look into that really do go through more about just what personalities look like, what they are, kind of those, and then also some tips and tricks too in each one of these. So just some things to, read at night. Please don't read them at night. You will have nightmares. Don't do that. But maybe, during the day when you've got nothing better to read.
And I want to highlight on this, the references used with clients. Obviously, this is not an exhaustive list. There are just hundreds and hundreds of books out there. I do lean heavily into Bill Eddy's work with clients because I think it's practical, it's on target, it focuses on personality disorders and those traits. And it's really just tangible. It's written for clients, so you can recommend a book to them, and it's not a textbook. It's digestible, and it really speaks to their experience. I also really like the Co-Parent Communication Handbook. The second bullet point here, lots of good strategies, and again, just tangible behavioral tools with higher conflict co-parents, ways to teach them how to shift the dynamic and make it a bit more tolerable and constructive. Oops. Yeah. So I think, Erin, you were
Yep, I have questions from the chat. So
the
I don't
chat?
know.
Okay, so this would be the Q&A section of this presentation.
Do you want to take the slides down? It's totally up to you.
Yeah, let's see. I guess stop share, right?
Yeah, perfect. Okay, great. And we do have some time because we did set aside an hour and a half. So if there's more chat or more questions, just throw them in the chat. But I'm going to start with what's up there now. So the first one is about gaslighting. And so it says, who gaslights others? So, and this was posted early on, when you were going through the different personality, the 5 sort of disorder options. And so it said, who gaslights others? And how does gaslighting fit into the categories? And also, please explain gaslighting. Then the same individual went on to say, how can the person being gaslighted recognize gaslighting and protect themselves from the gaslighter?
Good question.
We're already starting with buzzwords. I love this.
Yeah. You want to take this one since you talked about the narcissistic personality?
Since I talked about narcissists, yeah. So here's what I will say. First and foremost, you asked the question about who. Please know that anybody can gaslight. You don't have to have a personality disorder to gaslight. Okay. So gaslighting is basically, it's a repetitive manipulation. That's an important, those 2 words there are really important. Repetitive manipulation. This isn't something that happens once. It's a repetitive manipulation of another person's reality or memory. So they are throwing in these these kind of they're typically very subtle. Sometimes they're not as subtle, especially with narcissists, but they're typically more subtle, and it's just that didn't happen. That's not what happened. This isn't that never happened. This isn't the case. And I want to be careful here because people use this word a lot in what we do, and they use it in place of different perspectives. And I think that's really the key here to keep in mind. Two people can go through the exact same situation and have two totally different perspectives. So I'm going to give you an example. Somebody may say, you were doing, you threw this at me. Okay. And somebody may say, actually, I threw it next to you. Two perspectives, as opposed to somebody who is maybe more abusive or having some of those behaviors and go, that didn't happen. And multiply saying that didn't happen. Now, most of the time I will tell people in situations to write things down, to keep an account, to make sure that you are writing them down and you can go back to it. The recognizing it is a little bit harder to, if I'm being completely honest, and Beth, you might have something different to say here, but it's hard because you can say, well, maybe somebody's perspective is that it didn't happen. Well, maybe so, maybe it's more of a memory issue, but for the most part, is it constantly happening? Are they constantly feeling like, I know that's not what happened, or I know that situation did happen, and this person continuously is telling me that it's not, then okay, then there is something happening and I need to start writing it down. That's the first thing. I'm going to start writing down to make sure that I'm not misremembering things that happened. And then how to deal with it is a vastly different situation. That's a very a lot is the answer. Is there's a lot that somebody can do in order to manage that. But number one is get somebody involved. Get a third party. That's what I constantly am saying. So in these situations, most of the time it might be a mediator. It might be a co-parenting therapist, somebody else to be there to help you in those situations. When they're still together, that's a vastly different situation. Beth, I don't know if you have anything to add there.
Yeah, so I agree that the behavior has to be a repetitive pattern.
Mhm.
So it's a style of manipulation that exists in the relationship dynamic. And what I've often seen is when I'm working with the individual who feels they have been gaslit or a victim of this type of dynamic, they seem confused, overwhelmed. They're questioning their own reality. They're questioning their memory. And they will say things like, I know this happened, but he or she keeps saying or just swears it never happened. And so they start questioning their own judgment, their memory, their instincts. And so that's one of the ways that I kind of feel it and ferret it out in a dynamic between two people is if one person is describing that experience of, I feel like I'm going crazy, I don't even trust myself anymore. It's kind of a red flag to look for those patterns because that's sort of the outcome of living with that dynamic is often that individual really loses touch with their own instincts and doesn't trust themselves anymore. And that becomes part of the therapeutic work for that person once they're out of that relationship to recover from that pattern of manipulation is learning how to trust themselves, their feeling, their gut, their instincts, their observations, their memory.
And the other thing to keep in mind, because I think part of the question too was who does this just in terms of personality disorders. It is mostly individuals with narcissistic traits. Because again, they are better than they are manipulating. That is a key in one of the behaviors that they exhibit most of the time. The other thing that I do want to add is that one of those first slides, we talk about those core dysfunctions, and one of them is thought and their way of thinking. So sometimes if somebody with a personality disorder is perceived to be somebody who's gaslighting, they might also have that dysfunctional of a thought process. Again, now we're looking at that more in those categories, that more severe personality disorder. Their thought process may be so dysfunctional that they really don't remember it that way, or they remember things differently. And so are they truly gaslighting? Maybe not. Maybe not. It may be a product of the disorder, And that's something that you're going to absolutely need a mental health professional to tease out. Is this something that are they manipulating, or are they gaslighting? Are they manipulating and gaslighting, or is this part of their thought dysfunction?
Yeah, it's a good point.
Um, Okay, the next question is there any other questions that anyone has on that topic? Let me check.
I want to add something really quick, not to that, but I did see in the chat that somebody put a statement in here. Here is how a judge may perceive what you're saying. I'm guessing that was with the
It was
narcissistic.
no, it was like when that was put in the chat, it was kind of like in line with what you were saying.
Yes, and I think what they were looking at there is when I was talking about how the kid perceives something. And so just if you're working with somebody who's narcissistic, this phrase may be excellent. It may also backfire on you. So it depends on how that individual sees the judge. If that individual sees the judge as somebody who is a positive person in their lives, and they see them as somebody that is a peer, or we're on equal footing, that's going to go really well for you. If they see the judge as somebody who is punitive, again, that fear of inferiority, if they feel inferior to the judge and you use the judge, you've now lost rapport. So that one, I think, is one to be careful with. I think it can be used, if it's used in the right context with the right person, wonderful. I think that's an excellent strategy, but you got to be careful with who.
The next comment says, it sounds like a great degree of stress can push people into what appears like bipolar mindset.
Okay, let's be careful with bipolar mindset, because when I hear bipolar, I don't think of mindset, I hear disorder. So, and bipolar is a mood disorder. So it is not a personality disorder. Let's be very clear with our language. And one of the things to keep in mind is stress does cause people to have behaviors. We all know it. You've all been there. We all get stressed and things happen. So absolutely, stress can cause people to have different types of behaviors, and some of them may look very similar and have these traits of some of these personality disorders. It doesn't mean that they have a personality disorder. And I want to be clear too, like we were talking about at first, this has to occur in order to have a personality disorder. It has to be occurring in multiple areas of their life over a long period of time. So if you're seeing some of these behaviors that are happening just because of court, they're only happening in the court setting, they are doing just, nobody would say this about them at work. Nobody would say this about them when they're at home with their families, in social situations. It's probably not a personality disorder. It is probably, like you are saying, behaviors as a result of stress. Beth, I don't know if you wanted to add to
Yeah,
that.
I would echo that. I think a lot of people use the term bipolar from a clinical perspective inappropriately. And it's a misunderstanding of what bipolar disorder actually is. As Kara said, it's a mood disorder where people's mood and affect fluctuate from what we would consider major depression into hypomania or mania. And so, yes, there are some behaviors that can feel outrageous as they cycle up into mania, but this is vastly different from a personality disorder. And someone is not going to become bipolar when under stress solely. I think we just have to recognize that if we're working in the divorce arena, we are encountering people often at the worst time in their lives. They are under a tremendous, tremendous amount of stress. They're going to be losing so many things. They could be losing their home by choice or otherwise, but still having to move out of their home, losing some financial security, losing time with their children. Just that alone is really, really overwhelming, and it takes a lot to work through that. But in addition, sometimes people start to become financially insecure because the divorce itself is costing so much money. They're putting so much time into the divorce, it's impacting how they function at work, and now their job is at risk. Like, so the things that create stress for people start to stack up or fall like dominoes when you're in a divorce. And we see people at their worst. Does not mean they have a full-blown mood disorder like bipolar disorder, and it does not mean they have a personality disorder. That said, if people are presenting in ways that feel similar to what we've outlined, the strategies we've talked about can be very helpful, right? So those strategies are not just if a person has a diagnosable personality disorder, but they're just good strategies, interpersonal strategies for thinking about how to work with someone when they are that dysregulated and their behaviors or the way of thinking is becoming, distorted or dysfunctional. Yeah, so that was a good
Um,
question.
Thanks, guys. And I'm so glad you shared all that. I am working on a case right now that is so spot on to these exact sets of circumstances, to the point where the mom was actually misdiagnosed as bipolar and then re-diagnosed with PTSD while living with someone with narcissist personality. So I've seen it play out in just these ways very recently.
Erin, you are talking that what you just said is so common, is for people to be misdiagnosed, particularly when they have PTSD, because we see that's a whole different presentation, by the way. But truly and honestly, PTSD presents itself in so many different ways, and people have, that's another one of those buzzwords, and people often think military or they think sexual trauma, and so that leads to PTSD. But so many different things can, and the behaviors that come out with PTSD can look like a variety of different disorders. And so that's a great example to use, Erin.
All right, the next question is practical or appropriate in the context of divorce mediation? Maybe is it practical or appropriate in the context of divorce mediation to get the parent with the personality disorder to confront the underlying feelings that led to the pathological personality trait?
In the context of divorce mediation, I
My
would
initial
lean toward no. I would lean toward no. And this is, as a clinical psychologist mediator, I make it very clear in my contracts and also when I start working with individuals that although I'm a clinical psychologist, I am not your therapist in your divorce mediation. And mediation is not the space to heal, diagnose, treat, heal any psychological or psychiatric disorder. Mediation is a space to make decisions and reach agreements to help you get divorced. And so if somebody is dealing with a personality disorder that's making it impossible for them to function well in mediation, then I often ask, are you working with an individual therapist, right? Is that someone I might be able to speak to? Should we bring a mental health divorce coach in to help support the process? Because in mediation, we're not doing any treatment and we're not giving that kind of feedback, nor are we creating a forum for people to talk about pathology or disorders in that way. That would be that's my bias, my tendency.
I agree with everything you just said. Because I will tell you, what you said there in terms of confronting those underlying feelings is one of the goals of therapy when you're working with somebody with a personality disorder. But that takes a lot of practice to do, because if you do it in a way that is not timed right, that is not done with very specific, very evidence-based practices, you can cause a tailspin, and you don't want that. Because that can look that can be very detrimental to the family system and to that person. So if you're finding that that's what you want to do, the answer to that is this person needs an individual mental health professional who specializes in personality disorders, specifically the one that you're talking about.
Okay, here's the next question. Recently, I've seen an increase in people trying to use AI to do their quote unquote, do their own research, which of course can seriously backfire and produce inaccurate results. How would you recommend handling a client who refuses to accept that they are wrong, even in the face of being told their research has produced inaccurate results?
Oh, when people do their own
Draw?
research.
And this would be research, just for clarification, is this research into their personality or their mental health disorder, or what sort of research are we talking about?
I'm gonna, Abigail can let me know, but I think more legal research. So they're, they're in the context of a divorce case, and they've done their research that says the law says X when really the law is Y.
Mhm. Well, so as a mental health professional, I never give legal advice, ever. And so what I would find myself doing is referring them back to their attorney. Depending on what my role is, I may consult with the attorney, right? So if I'm their divorce coach, I would certainly consult with their attorney. If I'm doing mediation and someone starts bringing in inaccurate information based on their research and they're sort of challenging the process or the decision making, I would want to consult with the attorney, because I think, the best way to counter inaccurate AI legal research is with a consultation with an attorney who knows that area of the law, right? It's not going to be me if I'm the one doing co-parent consultation work or mediation or parenting coordination or whatever role I might be in. It's not going to be me who can confront the discrepancy or the BS research, so to speak.
Yeah, I completely agree with that. If somebody is looking for legal advice, I'm not giving that to you, and I'm going to refer to your attorney or refer you to a attorney if you don't have one. But the other side of that, because this question, everyone's doing their own research. Every time somebody comes in for a 604, they'll tell me, well, I know my co-parent has narcissism. I know my co-parent is a borderline. And I say, great. I thank you for looking into this. I love that you did the research. I don't mind when people research, but then I'm going to ask follow-ups. So I'm going to say things like, tell me what you found. Tell me what symptoms you see in this person that makes them borderline, that makes them narcissistic. Most of the time, the answer is they have traits. And so now I can say, now in my report or in my conversation with somebody, I can say, well, actually, this is how we diagnose, and this is what that would look like if this person was narcissistic. But what you're saying is they have traits of this. So let's talk about that a little bit differently. So I don't mind when people do their research. I think it's helpful as long as it's credible. Of course, I'm sure, listen, AI sometimes says great things, and I'm like, that's quite accurate, in fact. So I love that they're doing that. We just want to make sure that we are then asking follow-up questions and then correcting when it might be something that's inaccurate.
And I think I'm just going to point out, that what I'm hearing, and I think just great practice is like, have those therapists in your, referral roster, just like the therapists have the attorneys in their referral rosters, because I mean, there's probably most of your clients are going to need those referrals for individual therapists, if not the co-parenting, the reunification, and the list goes on. So it's just super important, I think, as practitioners to have all of those referrals for the therapist to help you with these sort of issues. So I just want to point that out. Those are the questions that I have. Is there anyone else that has any other questions right now? We have a couple more minutes that we can ask some questions. So if anyone has anything, just shoot out a question or put it in the chat.
Something else while somebody is typing up their question that I always add here, and I was going to do it when you were talking about antisocial personality disorder, and I totally forgot after you were done with that. But one of the things that I hear all the time from people is the words psychopathy and sociopathy, or psychopath and sociopath. We don't use those in the mental health community anymore. So antisocial personality is now kind of a combination of the two of those. They will, in the DSM, which is what we use to diagnose, they refer to those in the section for antisocial personality disorder. But I always feel like when I'm giving this presentation, I need to give this like announcement, because people use those words still, and we're just not using them in the community anymore. So.
I don't see any other questions. So I don't know, Aviva, if you want to throw up the, what is it called? Where we have to fill it out for the CLE. Forget.
The
Questionnaire.
Yeah,
Questionnaire.
I will launch that.
So I just want to thank Tara, and Beth so much for coming. I hope everyone found this as valuable as I think that I did. And I know a bunch of people from my team are here because this is stuff like I can hear this again and again, and it's so helpful to hear all of this. So thank you for coming. And I hope everyone else
Yes.
found it helpful.
Thank you for having us.
Yes,
Appreciate
thank
it.
you.
And